Yeah, I'm just going to go live and I'll introduce you while you're doing
okay.
that. Go live. Hello and good afternoon to you. Just about afternoon. It's midday and it's Isolation Inspiration. Here today with Dr. Georgia Ladbury to talk about the vaccine, really. She's an epidemiologist and is well qualified in such things. So we're looking forward to get her take. She writes a wonderful blog, actually, and it's well worth catching up on. And we'll publish the details of that because I've been reading with some interest as to your writings, Georgia. Welcome to the show. Thanks for coming on again.
Thanks for having me.
Well, that's our pleasure. Thank you for supporting us, the channel, and local people, because people are worried, people are scared. It's a difficult time. They're not sure what to understand. And I think what was particularly lovely about the way you wrote your last blog for me was that rather than being disrespectful to people who perhaps were worried about taking the vaccine, you took the opposite view, that there was reason to have fear.
Yeah, I think it's important that, vaccine hesitancy is a very different thing to being anti-vax. And I think we all need to recognize that. I mean, it is a leap of faith to, if you're healthy, to then inject yourself with a new drug. It is a leap of faith, and we need to respect that and acknowledge that and communicate, why it is that we very much believe that it's safe and it's the best option for people. So I think hesitancy is a completely reasonable thing, and it shouldn't be mixed up with kind of, being a mad anti-vax conspiracy theorist. Because
absolutely, I agree. And for me, I'm absolutely 100% pro-vaccine, and I know you are, but I know you are for scientific reasons. Could you relate a little bit of that to us in terms of, because obviously a lot of people are worried about the speed with which this has been developed. And one thing I picked up from your blog that I thought was very interesting, that we were actually developing a vaccine to tackle this kind of pandemic way before COVID hit.
Yeah, absolutely. So I think there's this impression that, all of the work against COVID-19 kicked off only when COVID arrived on the scene. But actually, we've been sort of preparing for a pandemic of a coronavirus for some time. We had the SARS outbreak some years ago now, quite a long time ago now. And the virus that causes SARS is really, really similar to the one that causes COVID. There's also MERS, I think it's Middle East Respiratory Syndrome, which is another coronavirus that has quite high fatality rates as well. So there was always kind of, there's been this interest in creating vaccines against coronaviruses. There's also, the Pfizer vaccine that's being used now. It's a new technology, messenger mRNA, which hasn't been used in a vaccine before, but that's been under development for, a long time. And it's just, we've been able to mobilize it over the last few months because there's been so much money thrown at it. And there's also been so much staff and kind of human resources thrown at it as well, because, people were redeployed, scientists and all the kind of associated people that work on kind of pharmaceutical developments dropped what they normally do so that they could work on COVID vaccines. So there's been a lot more people working on it. It's been expedited, all of the different phases and stages that are usually sequential and take a long time, and then there's gaps because there's paperwork and things like that. It's all just been speeded up. Stuff's been done in parallel where it's been possible to do that in parallel, and it's just been put right up to the top of the priority list. So they have been developed with phenomenal speed, but there hasn't been any kind of corner cutting when it comes to safety trials or anything like that. So I think people need to be reassured that, just because it's come about quickly, that's really just a testament to, what we can achieve as a species if we all come together and, like human ingenuity and working together and collaborating in the context of what is an emergency. But safety hasn't been compromised in the development of the vaccine.
Yeah. And this must surely be the biggest global collaboration ever in history.
It's amazing. I mean, at the beginning of the year, when they were saying, "Oh, we'll have a vaccine by the end of the year," I thought, "Gosh, how on earth did that ever happen? Like, will that happen? Really?" But it has happened, and it's because people have been working day and night to make it happen. Because we are facing this global public health crisis. It's something to be really proud of.
Yes, absolutely. Now, in terms of that, so we can understand why we should feel this is safe. So you mentioned that the trials that would normally take place and then be sequential.
Yeah.
So they've been running in tandem, presumably, so that these stages can be done, if you like, at the same time, even though they're being as thoroughly tested as they usually would. Is that right?
Yeah, so I mean, I'm not somebody who has worked in kind of clinical trials before, so I don't fully understand kind of what processes are usually sequential and what aren't. I think, kind of phase one, phase two, phase three have followed the same phases because you kind of need to do that for safety. So, you start with testing on very healthy people with no underlying conditions, and then if the safety is okay for that, then you progress to people who are potentially, have more underlying conditions, and you sort of go sequentially to sort of bigger and bigger trials that incorporate a wider, more representative population in the study that is more representative of the population who will receive the vaccine. So that will have been done sequentially, but other things will have been done in parallel. Like, I think, for example, they manufactured loads of the vaccine before they were entirely sure that it was going to work, which was a big financial risk to take. But it meant that when those studies came out and said this vaccine works, there were already sort of fridge fills of them ready to go. And that wouldn't normally happen.
Yes, absolutely. So in terms of the vaccine itself, obviously we have the Pfizer at the moment, but we've got other ones in the making as well.
Yeah.
So it looks like we're getting these vaccines. Have you any perspective on, we know that people in care homes right now are getting their first dose, but we also know that the second dose, which is 50% of the first dose, is necessary for protection. So it sounds like it's going to be a long way off the nation being mostly covered by these vaccines. Is that right? And what sort of time frame would you put on that?
Yeah, I mean, it's difficult to say. I think it's definitely a huge logistical undertaking to get, the people that we need to be vaccinated because we're talking about, millions of people across the UK. So, the NHS is going to be super, super busy making sure that happens. And there's a lot of logistical input going into that. I think, I mean, the Pfizer vaccine that we have at the moment is a great vaccine, and it's had really good efficacy in clinical trials. But the difficulty with it is that it needs to be kept at these very, 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 very cool temperatures. So that makes it kind of hard to sort of roll out at speed nationally. I think when the Oxford vaccine comes on the show, that can just be kept in a normal fridge. So it's going to be easier to kind of transport around the country and give to people, in greater numbers. So obviously we're prioritizing the people who really, really are vulnerable to the disease, who really need the vaccine. So, by prioritizing those groups, we should see kind of the pressure on the health service from kind of, severe illness and, the number of people dying should start to come down, hopefully in the early months of 2021. But there's still going to be COVID circulating, and we are, anyone that's unvaccinated, and even maybe people who are vaccinated, because we don't quite yet understand whether vaccination prevents against severe disease. We know that it prevents against sort of, symptomatic disease, but we don't know if it prevents against onward transmission of the disease. So we're just going to have to, continue with these control measures for some months, I think, into 2021, which is, is a disappointing thing to think, maybe, but I kind of visualize it as, a month ago we were in a really long dark tunnel, we were feeling our way along it, and but now there is light at the end of the tunnel, and we can see the light, we just need to keep walking towards it because that light is there now. So it might take some time for us to get to, but we will get there. And this time next year should look very, very different to what we're facing now.
Thank you. I should just point out to everybody, we are live. We can see your comments. So if you have any questions, we can answer. I can't promise that we'll get to them all, but if you have any questions, then do write them. We will see them. We'll pop them up on the screen if we can, and then give you any answers that we can from Georgia. Just on from that, so Christmas is coming. There's a lot of debate over whether we should continue to be locked down. My view, what I'm feeling, is that we're probably at the most dangerous point right now. Would you agree?
Yeah. I mean, I have to be honest and say we're not in a great place COVID wise at the moment. So, the rates are going up pretty much all over the country. They're going up very quickly in London. I think that's the downside of living in a really vibrant and busy city, is that it's densely populated, and that means that it's a happy place for infectious diseases to circulate. We're seeing hospitalizations kind of increase as well, so they're the highest that they've been so far in the second wave, and bed occupancy is increasing because of that. So we're seeing pressures on the health service on kind of bed occupancy and availability of ICU spaces, and I think occupancy has actually risen 20% in even since we released the lockdown, which I think was on the 2nd of December. So in those 2 weeks, it's gone up 20%. And we're about to relax restrictions even further for a period of 5 days,
which seems counterintuitive. How do you feel about this advice?
It's worrying. I'm not going to lie and say that I'm totally happy with it. I'm not. I am sort of lying awake and losing sleep at the moment over the prospect of kind of lots of households coming together and mixing over Christmas at this time that we do have increasing levels of infection and high levels of infection. However, I think we need to recognise that there's a really strong urge for people to come together at this time of year, and that is important to people. And we have had a really, really difficult year. So I think if anything, people are probably feeling the urge to see their loved ones even more than they normally would in this Christmas period. So I think the restrictions being relaxed is to reflect that, because you don't want to criminalize hugging someone at Christmas if you really, really, really feel the need. But as Chris Whitty has said, just because you can do something doesn't mean you should do something. And I think people need to recognize, and I hope that they do recognize, that these restrictions are being relaxed to recognize that need for kind of coming together at Christmas, but also to recognize in tandem that doesn't mean that it's safe, and that if you are planning to see loved ones this Christmas, it needs to be a very, very different Christmas to those that you're sort of used to, and you need to bear fully in mind the risks of transmission and mitigate those risks however you can.
Now onto that piece of advice there. If you've just joined us, welcome along. We have Dr. Georgia Ladbury. She's an epidemiologist and so has some knowledge of COVID and its transmission, and she's giving us some terrific advice as always. And so if you have any questions, please do ask live right now. My question to you, Georgia, is that, okay, we're going to loosen up these restrictions and we're going to be meeting with loved ones. Should we be, I noticed ventilation is being mentioned a lot more now. Should we be in the garden? Should we have the door open? What is your advice or view?
Right. So you should be outdoors as much as you possibly can, because what we've learned about COVID is that I think at the beginning we thought that it was spread mainly through droplets, which are kind of, the sort of visible droplets that you can see coming out of someone's mouth when they're speaking.
Yes.
And they're heavy and they fall close to your face, and so that's why social distancing works, because if you're far enough away from someone, then you're not going to kind of inhale those droplets because they've fallen close to that person. But what we've sort of learned as we've gone along is that aerosol transmission is also a problem with COVID. So aerosols come out of your mouth, they're sort of like a fine mist. You don't see them and they linger around in the environment.
Right.
If you're indoors and there's no ventilation, those aerosols don't get sort of wafted around, and those COVID particles don't then get sort of dissipated, and it means, like, if you're sat in a stuffy room for a long time with somebody who is breathing out those aerosols, they're sort of building up, and then it means if they were sitting on the sofa and then they went off to go and pour themselves a glass of eggnog or whatever, and then you went to go and sit where they were sitting, even if you were 2 meters away from them or more the entire time, you could breathe in those aerosols that they'd sort of left behind. And that is how a lot of infection is happening indoors. So like most kind of outbreaks of COVID, or where there's like transmission happening, is where there is close contact with people indoors. And that is why Christmas is such a risky period, because that it's the day that we're used to sort of sitting around the table, watching the EastEnders Christmas special together, like gathering under the tree, indoors with the heating up and no windows open. So it's just a recipe for, it's like a massive big present for COVID with a ribbon on it. So yeah, there's like various things that you can do to mitigate those risks. So I mean, my own family, we have decided to meet. It's my mum's 70th birthday on Christmas Day. We had been planning like a big get together with my brother who lives up in Hull, and to all stay at his house, and it will be amazing. And we've cancelled all of that now. It's just not a good idea to I mean, we could feasibly do it, and we could go and stay there for the 5 days if we wanted to. We've decided to not do that. He's staying in Hull. My parents, my family, we're self-isolating, so we have been for the last couple of days. So we're not popping out to the shops anymore. We're not, I'm not seeing any friends or doing any socializing.
Is that because you're symptomatic, or is that because you just feel that the risk is so high right now, Georgia? Why is it that you're self-isolating?
Yeah, no, I'm not symptomatic at all. So it's kind of quarantining myself before going. So COVID has an up to 14-day incubation period, and the real difficulty with it is that you can spread it asymptomatically, so you can be infected and not know. You can also spread it and have really high levels of spread 2 days before you become symptomatic. So it's entirely possible, if you're feeling absolutely healthy and no symptoms at all, to have loads and loads of COVID virus coming out of your mouth and not knowing. And I just do not want to be in the position where I am, in my parents' house, even if we're going to have the windows open and the doors open, which we will do. And we're only planning to have kind of dinner indoors and be sort of an hour indoors and spend the rest of the time, in the garden or in the park. But I absolutely don't want to risk, having spreading any COVID to them. So yeah, so we've decided to kind of isolate ourselves as households before we come together.
And does that include your children, Georgia? What are you doing about your children? Because I know you're a mother, and I think a lot of mothers listening will be interested to see what you say about that.
Yeah, they've finished school now, so that's good. So they're not kind of meeting up with all of their friends. So we're and childminder was closed as of yesterday. So they'll just be with us, and any stuff that we do will be outdoors and just as a household from now until Christmas Day. So yeah, it's going to be a really different Christmas. I've used to every single Christmas of my life, I've woken up in the same house as my parents, apart from one year when my dad was ill with cancer, and the risk of infection was too high. And I kind of feel like it's the same. It's the same this year. Like the risk of infection is too high. So Santa has been advised to land in the garden this year of my parents' house. He is not
no chimney.
Go down the chimney. We're going to have a Christmas tree outside. There's going to be stockings outside. Instead of mixing up the presents, he's going to put them all in separate sacks so we can each retreat to a different area of the garden and open stuff and not have this kind of constant coming back and forth to the Christmas tree. And then my dad's going to cook dinner. We're going to eat dinner in the living room. Luckily, my mum and dad have a really big living room, so we're going to be on separate tables and distance, and we're going to have the windows open at either end of the room, which means
so you've got ventilation.
Yeah, and it's really important to have that breeze as well. So it's not just having one window open at the end of the room. You need to kind of be able to feel that breeze and know that the air is moving along in the room. Separate crockery and stuff like that. We're not going to be sharing the gravy boat. And I think my dad's planning to decorate some buckets with tinsel and then fill them with a little bit of bleachy water so that we can then just shove our kind of cutlery in when we're done at the end of the day. So when he comes to do the washing up, if there was any kind of saliva that was containing COVID particles or whatever on our knives and forks, then it would have been killed by that bucket. So we've had a really long discussion as a family as to how we can do things as safely as possible. And I think it's really important for people to have those conversations and to plan really well and to make sure that that anyone that is mixing is really aware and of the expectations and of what the plan's going to be, because it's going to be a very, very different Christmas this year. And much as we really do need to see each other, I think for mental health reasons and things like that, we need to do it safely because we want to have many more Christmases kind of together. And so we just need to be on our guard the whole time.
Absolutely. Thank you. I think that was really insightful, because hearing what you do gives us some clues to perhaps what we should be planning better.
Clearly. I'm going to get out all my Christmas jumpers this year and wear them all at once.
I
think we're going to be outdoors or in a draft.
Definitely, you really are practicing what you preach in terms of making sure that you're staying safe, and particularly the thing that seems to be prominent now that wasn't before in the initial advice is the ventilation. That, you know, it was always hands and the rest of it, but it wasn't ventilation, was it? And so. And as you say, this is because of this new understanding of these aerosols, which is interesting and quite.
Yeah, I think it's the new understanding, and also, you know, over the spring, summer, kind of you're more likely to be outdoors anyway and have windows open, whereas now we are likely to be gathered together indoors with the windows shut, and so, you know, that kind of message for ventilation is more pertinent now as well than it would have been over the summer. But it's a combination of, you know, our behaviour having changed because it's the winter, and also, you know, our scientific knowledge on the aerosol spread in COVID has increased too.
Now, coming on to that, Georgia, on the understanding of the disease, we understand that there is a new strain in the south.
Yes.
Can we talk about that?
Yeah. I can't really talk about that in any depth because we're still, you know, very much finding out about it. Yeah. So I think, I mean, it sounds very scary having like a mutant strain, a new strain. Actually, viruses, they kind of mutate all the time. They do that, and there's, you know, it's been it's an RNA virus, so it's less stable than some other viruses as well. So we expect kind of new strains to emerge. Whether it's more transmissible, I think it's a theory now rather than based in kind of any evidence. I think it's been shown to kind of, you know, be in London and the southeast, and that is where we have like high rates. But it's difficult to know at this point, I think, whether it's a specifically very transmissible strain or whether it was a strain that got lucky and found itself in a few pubs and managed to, you know, pass itself around quite a lot. So we don't really know, and, you know, it is something that we need to kind of keep an eye on and get more evidence about. But at the moment, it's kind of, it's quite new information, and we need to sort of research that more. I would say, I mean, the reason we managed to pick it up so early is because the virological surveillance that we do in the UK is excellent. So by that I mean by tracking the different strains that are emerging in COVID. So we have laboratories that kind of, you know, do the full sequence of the RNA strain of the COVID virus, and then they're able to kind of pick up these new strains really quickly and really early on. So it's because we have really good surveillance that we know about it. So in a way, it's sort of a good thing that we know about it. I would say that even if it is a more transmissible strain, it's not so transmissible that it can evade all the public health measures that are advised anyway. So if you're fastidiously doing your hands face and your ventilation and you're, you know, limiting your contacts and all those things that you need to be doing to avoid all the other COVID virus strains, you'll evade that one as well. So
and likely the vaccine will also be effective against the new strain, doesn't it? As far as
it seems that like the vaccinologists say that it would be fine. So like it's a strain that's related to the spike protein, which is the protein that the vaccines aim to recognize, but it's not a part of the spike protein that's going to interfere with vaccine. I think that's the understanding at the moment anyway.
Right. Now, young people, I had a comment from someone the other day along the lines of, well, I'm young, if I get it, doesn't matter, does it? I know that's irresponsible and terrible, but also young people, they're missing their friends, they're desperate to socialize, and I don't think they understand the impact of things like long COVID. Can we talk about that?
Yeah, so long COVID, that's another thing that we're sort of learning about as we go along. So I think at the beginning of the pandemic, there was this idea that, you know, if you had underlying vulnerabilities, then you might be at risk of severe illness or of death. But if you were healthy, and, you know, didn't have any underlying health conditions, then, you know, worst that would happen is that you'd be kind of sick for a few days, and then you'd recover, or you'd get infected and not even know about it. As time has gone on, we have realized that there are many people who are becoming sick with COVID, not sick enough to go to hospital. So, you know, they manage at home, but rather than recovering and, you know, then getting on with their lives, as you would expect, say, with about a flu, they end up kind of still remaining sick for really some time afterwards. The problem with long COVID is that it's sort of a very nebulous disease, like we haven't quite defined what it means yet, because there's such a range of symptoms that can kind of persist in people, and because there's such a range, it's hard to define, and because it's hard to define, it's hard to count, and it's hard to do research on it.
Is it really happening then?
Yeah, exactly. It's like, is it, but the Office of National Statistics has done some work on it recently that was published, I think, this week. And it suggests that 1 in 5 people who are symptomatic with COVID are still experiencing symptoms more than 5 weeks after infection. So it's something that's making them sick for over a month. And for 1 in 10 people, they're still experiencing symptoms even after 3 months. And this is including people who were absolutely healthy when they were infected and, were young. I think it's affecting maybe women a little bit more than men as well. So it's a different kind of, we're used to kind of the narrative that it's men getting more sick with COVID than women. So it's a different beast, and it affects kind of, it affects all of us. So we need to really get away from this narrative that we had at the beginning of the pandemic. Like, as long as you're not elderly and you don't have vulnerabilities, you don't need to worry about COVID. We all need to worry about COVID. So, there's the element of, if you're young and you get infected, then you're also going to be contributing to transmission to other people, which eventually then does get, kind of infect people with vulnerabilities and who are elderly. But there's also, you could actually get very sick yourself.
Yeah, that's, I suppose, what I'm trying to get across is that even if you're selfish, actually, for your own selfish reasons, you should be careful, because there are people that are losing their taste of sense and smell, their sense of smell and taste for long periods, that wonder if they'll ever get it back. And I mean, that's quite shocking, isn't it, to think that you might not taste or smell again? Gosh.
And people who are finding it difficult even to get out of bed even months after having it, or having these really thundering headaches. And I mean, it sounds really nasty. And I think even at the beginning of the pandemic, I was a bit ambivalent, like, oh well, if I get it, like, I'll probably be fine. Now I'm like, no, I don't want to get it. I want to wait till I'm vaccinated. I do not want to get COVID, and whether I'm one of these people that's going to be, ill for 3 months.
And I hope young people wake up to that. I'm not blaming young people, because I think a lot of young people are very responsible, but I do get it. You're a young person, you're missing your friends, you're desperate to have that contact socially. But you need to do it responsibly in order to make sure that you don't with long COVID, which could be very serious for you, let alone whether you could transmit it to someone else and actually kill them.
Yeah, I mean, I think this pandemic kind of affects us all in different ways, and the control measures affect us all in different ways, and it's been difficult for everyone. But we all need to look out for each other, and especially now that vaccines are on the horizon, just like hang tight and keep together, because we are walking towards the light now.
Yes, let's talk about that now. Predictions for next year, where this is traditionally a time of year where we go, actually, what's going to happen next year? So tell us, how do you see this time frame? We've got the new vaccines coming online. No doubt there'll be more soon afterwards following. How do you envisage, because I know from your blog that you mentioned there that you see this as possibly a flu-like thing, where every year actually we have COVID raising its head regardless of whether the vaccines are effective, and it's largely innocuous for the rest of the year. So you could see this as an ongoing thing actually through history now.
Yeah, I don't know. We'll have to see how well the vaccines work, and also the level of vaccine uptake as well. But I think it's unlikely that we will be able to eliminate COVID from our lives. I mean, we've only ever eradicated one human disease from smallpox, and we've only ever managed to do that. We haven't eradicated measles or polio, all of those things that we've been vaccinating against a lot. And I think coronavirus is going to be one of those. I think it will probably just sit alongside us and rear its head every winter, and wreak some havoc every winter in the way that flu does. But it will be something that we end up kind of not even really knowing about, or not even thinking about that much. I mean, I think people working in the NHS will know about it, because there'll be the inevitable winter pressures that are caused by flu and also by COVID. But I don't think that we'll get rid of it completely. But I mean, I might be wrong. We'll see.
I hope so. I hope you're right.
Hopefully we're wrong. Hopefully I'm totally wrong.
There is some talk about the way that the disease spreads when the R number goes above 1 being exponential. We get that. But surely then does it not follow that if we get that rate below 1, then it will exponentially go down with the vaccines coming on board?
But you kind of
optimistically.
Yeah, the thing is, unless you have really, really high levels of vaccination, there's always like a little pocket of susceptible people that the virus can get into and have some fun with and spread to, and then like it seems that it's potentially a seasonal virus, given that we're seeing the numbers are taking off so much now. So you're always going to have the household mixing at Christmas. You're always going to have people that are unvaccinated, or people who were vaccinated but didn't respond very well to the vaccine. So the Pfizer vaccine, we're all very excited that it's like in the 90s of efficacy. That still means that in one in 10 people it didn't work. It didn't have an immune response to it. So I think, yeah, it's unlikely that we'll get rid of it completely. I think it will be a disease that becomes something that we call endemic, which is just like an infectious disease, and then there'll be periods of epidemics that we see in the winter periods, especially.
Yeah.
That would be my prediction.
Yeah. Would it be the case then that the vaccines would become more effective over time as we start understanding the efficacy in the field?
Yeah, hopefully. I mean, vaccine research is never done. So, the virus will change, it will mutate. As I said, that's what they do. And, it's always a bit of a game of cat and mouse when it comes to infectious disease control. Like, we do the surveillance, the virus changes, we change the vaccine, and it's, always one chasing after another. And sometimes we'll be in the lead and sometimes the virus will be in the lead. And, the work is never done, which is what, keeps people working in public health. So, yeah.
So where do you see it by next summer, Georgia? Where are we going to be then? Are we going to be in this is great, we're back, we're traveling in, we've got air travel back, we've got shops open, restaurants open. That's how it feels. Do you see it that way?
I think we're going to be in a much happier place next summer than we are now. I think we will have a significant proportion of vulnerable people vaccinated, at least, and maybe we might have even started rolling out into kind of, the wider population without vulnerabilities. I think, it won't be the winter, so probably the rates will come down anyway, partly because, maybe biological things to do with the virus, but also the way that we, move around in the summer and, just being more outdoors and not gathering together in these closed environments. Yeah, I think we'll be in a better place in the summer for several weeks.
Excellent.
Also, things like testing will hopefully improve things. So, the rapid tests coming more widely available, and yeah,
absolutely.
But there is hope. There is a lot of hope. I think the next couple of months. I mean, as I said in the last time we spoke, we're going to have a really difficult 6 months, and then I think it's going to get better.
Yeah.
We're now in the thick of the difficult 6 months, but I do still think it's going to get better.
Yeah. Thank you, Georgia. The last thing, and something that I really wanted to get across in this video, because it came across in your blog, and I want to make sure it comes across in this video, is question: once the UK trials are done of any vaccine, would you take it?
I absolutely cannot wait to get a COVID vaccine.
In a heartbeat, right? That's really what I want to get across to the nation.
I'd queue up all day long to get one, but I'd queue up as long as it was a socially distanced queue with very, very good ventilation and mainly outside. But yeah, I can't wait to get a vaccine. I can't wait until my parents are protected and I'm protected and I can hug them at last after months and months of just maintaining distance. So yeah, absolutely.
Forward to those times, yeah.
Yeah.
Thank you, Georgia. You're an inspiration. Thanks ever so much for coming on the show again.
And have a very good Christmas, however you celebrate. And happy and
we'll certainly consider your words and do it more safely, hopefully.
Cool. All right. Thank you so much, Ken. Nice speaking to you.